Hello, I'm Dr. James Bogash, creator of Bogash Life and Balance and expert in health and longevity. And today we're going to have a conversation about something I've brought up before, and that is social determinants of health, or basically how our social economic status plays a role in health outcomes. And this is something that people generally don't think of. So when we think of everything that we've done as a result of the pandemic and the changes that have occurred and the money that we've thrown around, we haven't fixed the underlying problem that put everybody at risk in the first place. And that becomes frustrating. So when we look at social determinants of health, there are a long list of these, but these have to do with things like what's called neighborhood and built environment. So basically how accessible are neighborhoods to fresh fruits and vegetables versus convenience store and fast food. Zip code. Is the zip code does it have a high level of poverty within it? So merely your zip code can have a role in your risk of having some type of chronic disease. Probably top of the list is cardiovascular disease, because there are some very strong associations between social determinants of health and cardiovascular disease, both heart attacks and death. Annual household income is another important factor. Access to health care. So is there one rundown community center, or do you live in the middle of, like where I live, they just built another hospital right in between two other hospitals. So no shortage of access to health care in the area that I live in, but that's not always the case. Other things like racial, so black skin color has an effect on social determinants of health, and that boils down to racism and social isolation. So basically, people that are in prison versus volunteering at the YMCA are going to have different outcomes. So the more things that we have that keep us, that are desirable when it comes to social determinants of health versus undesirable, the greater the risk is for things like heart disease. And this particular study, really, if you really want to go into depth in the social determinants of health, this particular article looks into all of them. But they looked at how much a group of people, they followed them for almost 11 years to see how much social determinants of health played a role in both heart attacks and fatal heart attacks. And it turns out that the people who had worse social determinants of health had, so greater 3 or more, had a 286% higher likelihood of having a fatal heart attack. For having a non-fatal heart attack, those numbers were even higher at 544%. It's like just a very significant contributing factor to what remains our number one killer. And the frustration with all the money that we've been throwing out related to the pandemic has nothing to do with fixing these determinants of health. We didn't drive money into the poorer communities to try to improve, like subsidize the Sprouts in there, or farmers markets, put more parks. There's lots of ways and ideas to stimulate the health in those communities, and that's not at all what happened. And yet those socioeconomic factors clearly play a risk in not only being diagnosed with COVID, but also with having bad outcomes for COVID. So in the future, we really need to start focusing on this gap between the haves and the have-nots when it comes to social determinants of health. If we don't, nothing's going to change. And the next time a pandemic comes around, it's going to have the same outcomes because we haven't fixed anything. All we've done is social isolated and wore masks and maybe came up with a vaccine that we're not quite sure how well it works just yet. So as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the